Hi, my name is Scott Ruta from Nyack Exchange, and this is my co-founder, Amanda Wilson. Today what we're going to instruct on is the use of a foam roller. This is a piece of equipment that I have used for many years in my physical therapy clinic to use in conjunction with formal physical therapy. People ask, well, why do you use a foam roller? And it's simple. The answer is simple. It's another way of elongating tissue. So rather than a traditional hamstring stretch where you would elongate the tissue through lengthening, you can also lengthen the tissue through foam rolling. Today I'm going to demonstrate primarily leg uses for the foam roller, or leg stretches for the foam roller. The number one use for this roll that I have witnessed in my career is the iliotibial band. It's a structure that runs down the side of your thigh that causes back, hip, and knee problems. So we're going to demonstrate the iliotibial band first, and then I'm going to show you some stretches for the anterior part of your leg, your quadricep, as well as the hamstring and the calf. So we're going to start with Amanda in side lying. Your bottom leg is going to go straight. Your top leg is going to be bent. And you're going to think about weight bearing through that leg and your arms to either increase or decrease how much weight you're putting along your IT band. I will tell you, all of your IT bands are going to be sore to some degree, some worse than others. But you have to start rolling to get them better. So as you're seeing, her leg is straight. She's basically rolling from her hip joint towards her knee joint. In the middle, you're going to find some sweet spots where you're going to find some knots or some sorenesses in your IT band. Stay on them, roll on them, try to get them broken up, and you're going to notice as the days, as the weeks go on, it's going to get more comfortable. While we're in that position, there's a muscle on the front aspect of your hip joint, and if you turn your pelvis just obliquely, just a little bit right there, it's called your TFL, or your tensor fascia lata, and that's a muscle that attaches into the iliotibial band. Most of us overuse that muscle instead of using gluteal muscles, so that's another good muscle to attack while you're maybe taking a little bit of a break from your IT band. You can do them together, okay? 2 to 3 minutes to start with, and then we're going to progress up to 5 minutes on each leg. The next muscle group is your quadricep muscle, so she's going to rotate her pelvis so her tummy's pointing down. Now her tips of her toes and her hands are controlling how much weight she's putting through her quadricep muscles. And as you can see, she must not have really sore quadricep muscles because she's able to completely unload those legs to provide, again, a roll, but it's actually a stretch to that quadricep muscle. Okay. Lastly, she's going to flip over to her back side. She can start on her tush, can start on the gluteal muscles, and you can just roll back and forth straight. And I don't know if any of you out there have any piriformis or deep hip rotator gluteal symptoms, but if she rolls her pelvis just a little bit, sometimes you can find a sweet spot of your piriformis muscle or your deep hip rotators. Same thing, she's going to go on an oblique angle. And again, this is, complementing what your physical therapist is doing or what your massage therapist is doing. And then she can go towards hamstrings. And again, she's going to put as much pressure as you possibly can through your legs to give yourself a stretch. And then lastly, she can get even all the way down. Go that way, and we can get to your calf muscles. Sometimes it's a little tough to get a great roll out of your calf muscles just because you don't have as much weight-bearing capabilities. But several of my patients say, man, they start from their heels and go all the way up to their lower back. Okay? So this is the foam roller. Every physical therapy clinic should be teaching you on how to use this in conjunction with your traditional stretches.